Hello, my name is Dr. Philip Miller. I'm a facial plastic surgeon here in New York City. I'd like to talk to you today about fat transfer in facelift surgery. I encourage you to see my other video, Fat Grafting, what it is and why we do it, in order to get a better idea of what fat transfer is. Briefly, fat transfer is taking fat from other parts of your body and placing it in areas that are needed. Now, we do that in particular in facelift surgery because of the following. Facelift surgery is a broad term used for rejuvenation of the face. And in the old days, all we thought about was surgery, pulling back or pulling up. Now, that concept was based on the fact that we all thought aging was related to laxity of the skin and the fact that the skin would fall as you got older. But further evaluation demonstrated that it wasn't just that the skin was falling, but perhaps there was volume loss as well. What I mean by volume loss, well, it's good to make an analogy. Think of a hot air balloon, and it's filled with air, and it's nice and big and robust. Well, what if we take a little air out of that balloon? You can imagine what would happen. The canvas of the balloon would start getting waves in it, would start having dimples. And in fact, the canvas itself might start falling to the ground if too much air came out of the hot air balloon. One thought would be, well, if we just made that large balloon into a smaller one and sewed up a bunch of things, well, then that would look a lot better. But another technique, another concept would be, why not just put all the air that had been taken out, why not replace it, and the balloon would be restored to its original size, volume, and would no longer be falling over, but would be standing erect. That's the concept now of fat transfer in facelift surgery. If you can restore the volume of the face that was present when the individual was younger, in addition to trimming the excess skin and repositioning some of the persistent fat and volume, you get a much more natural result. That is why the newer techniques for face rejuvenation procedures involve not only repositioning the tissue that is lax, but also restoring the volume that has been lost over the ages. This is Dr. Philip Miller answering questions about fat transfer in facelift surgery.